Johnny has recently sustained an injury to his oblique sesamoidian ligament. He's an excellent candidate for regenerative medicine. Typically we use a steroid to manage inflammation. The problem with steroids is that steroids also reduce healing and they stop the healing process. And we're trying to augment the healing process. So the product we're going to use is something called IRAP. And IRAP is what I would consider regenerative medicine, meaning we're using a product from the horse's own body to help heal itself. And what we did is 2 days ago, we pulled blood from his jugular vein, and then we processed it by putting it in contact with glass beads that are covered with chromium sulfate. The chromium sulfate stimulates the white cells to produce proteins, particular interleukin receptor antagonist protein, plus a whole soup of other products that mediate cell function. And it's really not clear whether it's interleukin receptor antagonist protein, or what we call IRAP, or whether it's one of these other cell mediators. Regardless, the product is very, very effective. So what we did is we took this blood home, we incubated it with those glass beads. After 20 hours, we separated off, and we were able to get 9 syringes full of treatment, using 1 syringe per treatment. So what we have is we have a syringe labeled specifically for this horse, a product of his own blood, and it's frozen, and now we're just in the process of thawing this syringe. And we're going to thaw this out. Once this product is ready, we'll put a filter on it and we'll inject it and filter it again. It's been filtered once, it'll be filtered again just in case it's a precipitate. So this is practice in Michigan. It's probably 8 or 10 degrees right now in the barn. We're going to try to keep the horse comfortable by putting a light cooler on them, because oftentimes they sweat with sedation. So the cooler allows us to manage that and still keeps out of our way. And I think we're ready to go. Let's go ahead and fire that up, please. Alcohol back. So the key to making sure our therapy is effective is we want to make sure we get the needles exactly in the location where the injury has occurred and get the therapeutics there. So here I'm using ultrasound to help guide the needle for correct placement. Horse is moving a little bit. We'll get it right here. Nice. Needle's right there. Good. And now we can, through ultrasound guidance, control the injection into the desired site. Okay, good. And we're going to take the probe away. Excellent. Okay, and the procedure is done. Good.